Hello, and thank you for tuning into Neuro News Now. I'm your host, Claire Simmons. In this episode, we are focusing on stroke. May is Stroke Awareness Month, and while strokes don't just happen in May, we are taking this time to share life-saving information with you. Today, you will learn about the latest advancements in stroke treatment and technology, why the role of a stroke navigator is helping the patient recover faster, how to reduce your risk of stroke, and you'll hear from a 27-year-old stroke survivor. The stroke team at Carolina's Healthcare System's Neurosciences Institute is enhancing the treatment and care for stroke patients with telestroke. Telestroke is video technology that provides the best stroke care possible to patients who may not have time to drive to a comprehensive stroke center. With telestroke, stroke experts at another hospital are able to instantly talk to the patient and the care team right where they are. For such a time-sensitive medical emergency as stroke, this service is invaluable.
Telestroke allows us to leverage technology, particularly the internet, to provide high-quality, real-time, face-to-face patient evaluation to allow more effective patient care and decision-making.
Benefits of the telestroke program include faster treatment, better outcomes, reduced complications, and less cost to the patient. Some of the greatest advancements in treating stroke over the past year have come from advanced endovascular techniques and equipment. One example is a procedure called mechanical thrombectomy. This is when the doctor inserts a device in the patient's leg that travels up to the brain to remove blood clots. The clots are what causes the patient to have a stroke. Patients who receive this treatment tend to have reduced volume of damaged brain tissue compared to those who do not.
Stroke is actually treatable. For many years people thought, we can't do anything. It's too late. It's a sad situation, but I wish we could have done something. Now we really have tools and decision-making options that'll let us treat patients quickly.
So far, the data from the clinical trials from this procedure has been overwhelmingly positive, proving that this is the best treatment for carefully selected stroke patients. Having a stroke is a life-changing experience, not only for the patient, but their family and loved ones too. The aftermath can leave everyone feeling overwhelmed and confused. The relationship between the patient and the stroke navigator begins early on as they come to meet the patients while they are still in the hospital to provide education about their stroke. They also talk to the patient and their families about their personal risk factors and the suggested lifestyle changes the patient may need to make in order to help reduce their risk of suffering another stroke in the future. The navigators work together with a multidisciplinary team to ensure that the patient has the appropriate therapies and resources in place at the time they are able to go home.
So we talk about diet, we talk about activity, we talk about medications, and ultimately our goal is to get them back once they're out in the community to our follow-up clinic.
The navigator even calls the patient at home to check if they have the proper resources and medications they need and to reinforce the education that was provided in the hospital. Strokes are becoming more common at a younger age, with about 1 in 5 victims now below the age of 55. Take, for example, 27-year-old Aaron, a high school lacrosse coach.
Went to bed, my legs started convulsing, wanted to get up out of bed and hit the ground immediately. That's when I knew something was probably up.
Aaron is one of the more fortunate victims of stroke. Strokes are one of the top 3 causes of death in the United States and the leading cause of long-term disability. However, by making an effort every day to move more, eat more fruits and vegetables, get more sleep, quit smoking, and regularly checking your blood pressure, you can cut down on your risk of having a stroke. Thanks for watching this episode of Neuro News Now. I'm Claire Simmons. See you next time.